Okay, today I am going to be continuing on the study guide for um, exam 6. I'm just going to be brief about it. I'm going to be talking about patients needing immunosuppression. Okay, what is immunosuppression? Okay, these are patients who their immune system are very weak. Um, they are unable to protect them. They are from anti-infection or bacteria out there. Their white blood cells are low. These patients are usually cancer patients. So say the due to the bone marrow suppression by some cancer medication. The most significant um, adverse effect of chemotherapy is that this client or patient who have neutropenic might develop a high fever or have a prudent drainage even when an infection is present. Okay. Some of the nursing action that you need to know is you need to monitor their vital signs, you need to monitor their white blood counts and neutrophils count. Another one is that you have to report for fever, report any fever that is greater than 37.8 centigrade or Fahrenheit or 100 degrees Fahrenheit to the provider immediately. You monitor the skin and the mucous membrane for infection. Um, obtain a prescribed culture specimen to initiate antimicrobial therapy. Protect skin and mucous membrane from injury. Okay, use something like a moisturizer. Practice frequent repositioning of patient if patient is not able to move themselves. Provide immediate attention to any skin breakdown. Okay, then finally implement neutropenic precaution, which including placing the patient in a private room. Neutropenic precaution, when we put them in a private room, we're not putting them because they have an infection. We are putting them there because we want to protect them from ourselves, from our bacteria, because their immune system or their white blood cells is very low that it is not going to be able to fight this bacteria if ever gotten in contact with. Okay, so the patient education for this patient is going to be avoid crowd while undergoing therapy, take the client temperature, ask the client to take their temperature on a daily basis and report it if it's elevated. Just avoid food source that could contain bacteria, just like fresh fruits, fresh vegetables, uncooked meat, uncooked fish, and egg. Like sushi. Those are stuff that need to be avoided. Avoid walking in the yard or garden or changing pet litters, and discard beverages that has been sitting at room temperature for a long time, any time longer than 1 hour. Wash glasses and cup after each use. Use toothbrush use toothbrush daily in the sorry. Use toothbrush daily in the dishwasher or rinse all with bleach solution. Do not share toiletries or personal hygiene items. Report fever greater than 37 or 0.8 centigrade or 100 degree Fahrenheit to the doctor immediately. Okay, so Ask them to call the doctor if their temperature is greater than 100 degrees Fahrenheit. That is one thing that they need to know for this area of your test. So patient education, what are the nursing actions you need to do, which is the same thing. It's just basically the same thing. What you need to do and the education you need to give to the patient, assuming he's going home and going to be taking care of himself. So thank you, and I wish you the best of luck in this test, and make sure you subscribe so when I do any more video you will be notified. Bye. See you guys on Monday.